Good morning, all. Thank the AOS organizing committee and Bosch and Lomb for giving me this opportunity. So I will be talking basically on the machine and the our experience. So this is a new Tenio with the bed. If you see, the contour is the natural shape of the spine, and this optimized head position is there because it helps in the patient not able to move his head so much. And it's a very comfortable. Actually, I tried once to see whether it is comfortable or not. It is very comfortable. And we have the advanced diagnostic platform with Zyoptics, and we don't have to search for pen drive or floppies and all that. And it's a very seamless flow of data from the workstation to the machine. And this new machine has the touch screen, which is very comfortable. So if you actually put the, like phaco, if you cover it with a sterile this thing, we can also use the touch screen ourselves. And suppose in case of an emergency, if our assistant is not there, to help us. And all the panels are very easily seen, and we can use it. So the whole thing, no, from the system check to the final treatment screen, even a junior most assistant is there, we can easily guide them. So as we all know that all these lasers, we need the speed and accuracy. So this machine, this spot size is around 1 millimeters, and faster, and there is a 2 millimeter spot size also, and so it is very fast. So those who have used the machine before, those who have us, I have been using Bosch and Lomb from 2004. So I have used the previous machine also. And this stereo is very fast. Before the blink of the eye, the procedure is over. So around 1 second per diopter it takes. So if you have 5 diopters, within 5 seconds or 6 seconds, the whole procedure is over. So why is it very advantageous is the main thing is before the patient moves the eye too much, it is over. We can just ask once before starting the laser, we can just tell the patient in another 2 seconds, 3 seconds, it will get over and the whole procedure will be done with. So tracking also is much better because this is the advanced high-speed tracker system is there with a frequency of 1740. Previously it was around 500 hertz. So it is much more faster. So what is the main advantage with that is it tracks all the X, Y, Z also. And it is a cyclotorsion is also getting tracked. And suppose the tracking goes off, we can use the new, before we have to go back and do here, we have to just click on the present eye movement, and then we can get into the present image, and we can go ahead and do the laser. So that is one advantage compared to the previous machine. And there is less risk of misalignment in when it moves in the Z axis also. So we have the settings of the optical settings. This one thing we have seen is the slightly lower illumination. If you use, patient is also very comfortable, and we also have a very good view. So less dazzling effect rather than the previous model. And the iris recognition is pretty fast. This is very important because it makes sure that we have the correct eye is always operated upon, and so the accuracy and the torsional thing also will get tracked with this iris recognition. So these are the various steps, as we all know, and I have done it myself, and it is very pretty simple. You choose and confirm the treatment, and then pupil, you center the pupil, and then start the iris recognition, and all the 3 trackings will be on. All the 3 lights are green. Small video to show this thing. So it is pretty simple, no complicated thing. Even we can train our mid-level ophthalmic personnel for this, or we use our instrument department. And here we have used all to remove the epithelium. Once the epithelium is removed, I have gone in for the laser. And as you can see, hardly 3 seconds or 4 seconds is the whole procedure. It is done with. And here we have done 6 diopters pure spherical with a 40 and 41K, around 6.5. We lifted the flap and femto laser, this was femto flap. And you can see that the whole laser is 6.5, hardly it takes only 4 seconds for the whole procedure to get over. And this is the post-op picture, where you can see the laser is well centered. So this is another one with a 5.5 with a 1.5 cylinder, a pre and a post, where you have got a very good result. So these are the treatment options available, Xioptics HD Echo and ProScan. HD treats both the existing ocular aberrations and those that is induced by the laser also. Whereas in echo mode, it's something like the tissue saving mode of the previous model, where you have some amount of tissue saving and it will correct the existing aberrations that are there in the eye. And ProScan, we have to feed the data, subjective data has to be fed, like the PRK of PRK, this thing. And we have to feed the subjective data. And for some cases, we use this ProScan mode also, especially when the powers are very less, like 0.5. I prefer to do this when it is like 0.5, 0.75, when we are going for selection sometimes, and they're not afford, we go for this PRK mode, or when the risk K values are different, we use this. Supracar has been dealt with. PTK is also available in the system. We have done a few cases. And transepithelial PRK, we are yet to get it, and we'll be getting it shortly. So that the epithelial debridement is a single step procedure by the laser instead of alcohol. And there are this thing, only thing is it's high speed and single nomogram, so it's much easier. Whereas in the conventional PRK, we can have a toxicity to limbal stem cells and slightly greater post-op pain. But otherwise, at the end of 3 months, if you see, it is almost similar compared to the conventional PRK, the results. So we'll be acquiring it shortly.
Okay, Dr. Meenakshi, Dr. Reddy here.
We have done around 1,000 to 829 eyes since we got it in January 2019, out of which myopic astigmatism was 1,301, and astigmatism plain was 54, and myopia was 474. And all the patients, around 95% of the eyes achieved 20 by 20 uncorrected distance visual acuity, and 100% of the eyes had less than 0.5. So this just shows, this is our experience with this new machine. So that shows that good efficiency and predictability is there. And we have been using this from 2005, actually, caution law. Thank you, one and all.